All right, now for about 100 years, the words marijuana and controversy have been nearly synonymous. So for those of you seeking change, the real trouble has been determining fact from fantasy, truth from fallacy, reality from fiction. To help us do that in an objective, credible way has been Dr. Sanjay Gupta, who we welcome to the program tonight. Good evening, Dr. Gupta.
Good evening, Steve. Thanks so much for having me.
I'm so glad that you had an opportunity to come on the program. I've been fascinated with your coverage of this information since you made your turnabout. I've always wanted to ask you, when you made that turnabout, how were you received by other colleagues in your field?
Yeah, no, it's a good question. You know, it's funny. I think that the medical community has actually been, even if they haven't been outwardly supportive of this issue, I think a lot of people within the medical community have recognized the merits of being able to study this scientifically and the promise that it has shown in some areas. You know, there was a paper a few years ago in the New England Journal of Medicine where they basically created a patient's story and asked, polled doctors what percentage would consider using medicinal marijuana in this case, and I think it was close to 80% of doctors say they would consider it. So I think there is an openness about it. I think even within my small section of medicine and neurosurgery, this month, in the month of April, marijuana and some of the science around it is on the cover of the journal. So it's been received well, and I think it's fostered a lot of discussion.
What made you dig into this subject on your own, independently? What was the cause? What was the impetus behind that? Was it Charlotte's Web? Was it Josh Stanley and the Charlotte's Web strain and seizures?
Well, there was almost a drip sort of way that this happened. You know, in the past, as you may know, Steve, before I had the turnaround, I did not think the evidence was particularly compelling when it came to medical marijuana. I looked at the U.S. evidence, and most of the studies I saw, over 90% of them, were talking about harm of medical marijuana, a very small percentage to look at benefit. And I realized that was sort of the system as opposed to the facts, meaning that the studies were designed to look for harm in the first place. The studies that were getting funded in the United States were designed to look for harm.
We're talking about the National Institute of Health.
We're talking about the government agencies which fund and approve marijuana research in this country, which include the FDA, the DEA, and the National Institute on Drug Abuse, NIDA. Right. They all have to approve a federally approved research for marijuana, and so much of the research was not looking at benefit. I mean, look, National Institute on Drug Abuse is one of the agencies that has to approve it. Their mandate is to study drug abuse, not drug benefit. So that was one thing. And so when I started to look at other labs, I would hear from other researchers who say you need to look at these studies and look at studies that were coming from places outside the United States and look at studies from labs that were not federally funded. And when I really started to dig into it, it started to paint a different picture. And that started the investigation, I think, that there was more to the story than what you might find just looking at the United States scientific literature. And that took me to meeting people like the Figge family and obviously Sweet Charlotte and the Stanley brothers who had created Charlotte's Web, but also lots of other researchers and traveling to Israel and spending time with Rolf Meshulam. These were all parts of that journey.
When you did Weed 1, I really did not expect, because it wasn't Weed 1, it was just weed. I wasn't expecting a 2 or a 3. What made you go into 2 and now 3? Because I really didn't expect 3 to come out, which is premiering this Sunday night at 9 on CNN. Am I correct?
That's correct. Yep, 9 Eastern on Sunday. You know, I think as we work on these documentaries, there's so much to them that almost even before you're done with one, you realize that there's enough for a second documentary, or that you've only been able to tell a small part of the story. If the first documentary sort of looked at what had happened in the past, the second looked at the current state of affairs at the time, and the third one is sort of looking to the future. What's this medicinal marijuana revolution going to feel like, look like? What is happening here? And look, already we start thinking about what beyond that, because we've gotten some amazing access to some of the earliest trials now, randomized trials, really pristine scientific method in terms of studying this. people are going to see these trials underway. They're going to want to know the results as well. We share some of the early results, but how does this all pan out over time, I think is going to be something that we might even explore later. So, I don't know. I'm kind of like you, Steve. I didn't know when we did the first one that there'd be a 2 or there'd be a 3 either, but there's just so much around this issue, around medicine in general, around marijuana in particular, around our drug policies as a whole.
When I looked at a congressman once and mentioned, and I'm talking about a federal congressman, and said the words medical marijuana, he looked back at me and said there is no such thing as medical marijuana. So from that perspective, isn't marijuana and medicine, aren't they juxtaposed terms?
I don't think so. I would disagree on that. I think that right now it is scheduled as a Schedule I substance, whereas in part of the definition of a Schedule I substance it says has no accepted medical use. But I don't think that should be a Schedule I substance. I think that it has accepted medicinal use. I've seen those accepted medicinal uses. They're verified in the literature scientifically. These aren't just stories and anecdotes. Just because it has been a heavily stigmatized substance in the United States for decades doesn't mean there haven't been other places, legitimate places, big hospitals, using scientific method to study this. Those studies exist. So I think the congressman, whoever this person was, probably needs to look at some of that data like I did. I'll be the first to say again, I fell into that trap. I did not find the data particularly compelling when I first looked at it, and that's why I have been down on medical marijuana in the past. But it takes digging, and when you dig, sometimes you find things that surprise you.
It's a bit of looking past the skew of that information.
Yeah, and I'll tell you just and a more broadly relevant point, Steve, is that it's not just marijuana. It's a lot of things in our society. When you look at the data that is presented to you, even scientific data, it is always worth asking a few more questions. Who funded the data? Where did it come from? What was the hypothesis these researchers were starting with? Were they trying to find benefit? Were they trying to find harm? What other papers have they published? Here's another one. With the marijuana literature, almost all of the patients who are in the studies are patients who have already failed every existing therapy. They are a particularly difficult group of patients to treat in the first place. So it's not as if these are people who are getting their first treatments for whatever malady they may have. And so they already you're going to have a more difficult population of patients to treat. You can't treat that data the same as you would treat other data. I may be telling you more than you want to know, but I'm saying that it takes time to really interpret these studies and put them in the context that I think is so necessary before you report it.
Well, what's the most surprising thing you found in the work that you've done leading up to these 3 documentary studies? What was the most surprising thing that came to mind?
Well, I mean, one of the surprising things that came to me after the first one aired was that it was a little nerve-wracking to put this on the air, and it's a little nerve-wracking to say something that is different, first of all, than what I had said in the past, and different than what a lot of people are saying currently. So that was just a nerve-wracking experience. But what surprised me afterward, I think, was how many people, both within the medical community, within the legal community, within law enforcement, but also our kids, friends, parents, grandparents that would come up to me and talk about this issue. And here it is, this thing that people are fearful to talk about because it is so heavily stigmatized. And all of a sudden, this was a topic that a lot of people had thought about, especially because maybe they had a loved one who had suffered, and they wondered if something like this could have helped them. And they want to talk about it. I think there's a much broader openness to this than people realize. We know that the majority of the country is now in favor of marijuana. We know 3/4 of the country favors it for medicinal purposes. But I think the support runs much deeper than you would initially think, looking at America as a whole.
The words human endocannabinoid system, is that something that's prevalent in the medical community? Because it seems to be in the medical marijuana community. They're becoming very familiar with this new discovery.
It wasn't something that I learned in medical school, and what you're talking about is this a system of receptors in our body that allow cannabinoids to bind to them. We have circulating endocannabinoids in our body. One of them is called anandamide, and it is a marijuana-like substance which circulates in our body. And
it's produced by our body?
produced by our body. It's endogenous, meaning we produce it, it binds to the receptors, it does it all on its own. And we know that there are some people who may have low levels of those endocannabinoids. They may have high levels of receptors, so not enough cannabinoid to actually stimulate all those receptors. It could be all sorts of different things. We know certain disease states, even the speculation is with post-traumatic stress, you have too many of these receptors and not enough of the substance in your body. And so when you give a substance that binds to those receptors, you can help restore the brain to a more natural state. That is a hypothesis, but that they don't know for sure yet. That's what they're trying to study. But that is an idea of the mechanisms by which this can work. We evolved as human beings with cannabinoids. So the idea that we have cannabinoid receptors in our body is not that surprising. I think what is surprising for a lot of people is that there's a whole system, an endocannabinoid system in our bodies.
And it controls and regulates a number of various different functions. Isn't that correct?
We have these receptors in our brain, but we also have them in our gut, for example. And the idea there is that if you have cannabinoids that can bind to these receptors, the thought is that it may be exerting an anti-inflammatory effect. So people, for example, who have inflammatory bowel disease, who use extracts of marijuana, sometimes get tremendous relief. It doesn't, by the way, relieve everyone's symptoms. No medicine does. But it does seem to offer benefit in a lot of these patients who have not received benefit anywhere else. So if you have inflammatory bowel disease and you're able to give a substance which stimulates the anti-inflammatory receptors in your gut, could that have a benefit? The answer seems to be yes, but this, again, Steve, it's exactly what some of these studies are going to be all about.
Needs to be studied. Are a lot of these studies actually happening? Have they been approved by the federal government yet? Are they underway?
Yeah, that's, I think, that was, to me, as a scientist, was probably the most interesting thing and I think exciting. I say that there's a revolution going on because there are a lot of studies now getting approved. There had only been 16 studies that had, been approved and received marijuana from NIDA for many years, and now you're having that many over the last year alone. So it's really starting to change, and I think also the academic scientists who previously, just because it was such a stigmatized world, they weren't even going to dip a toe into that world, and now they're diving in head first. So, you're getting different levels of researchers, you're getting different levels of support, you're getting, bipartisan legislation on the floor of the Senate, you're getting the President of the United States talking about it. You feel like something is happening. There's real movement and momentum with regard to marijuana.
Two other quick questions before you go. I know you're really busy and you've got a full schedule promoting this upcoming.
No, I'm happy to chat. Yeah.
So, with this medical marijuana, is there going to be a time when you walk into a pharmacy and there will be different forms of this as a patented medication produced by a pharmaceutical company? Do you see that day coming?
I think that day could very well come. There's already a pharmaceutical company, GW Pharmaceutical, which is now trialing medications that are cannabis-based medications in the United States for things like epilepsy. I think that could very well happen. I think one of the things that I think is going to need to be resolved is that when it comes to marijuana, one of the pioneers of marijuana research, a guy named Roth Meshulam out of Israel, really speaks about something known as the entourage effect. And what that basically means is that while there are some very active components in this plant, there are other smaller components which probably all play a role in terms of exerting medicinal benefit.
They work together.
So the idea of just taking out a single compound and turning it into a drug may not be as effective as being able to use the whole plant. How that gets translated into medicines, I think we're going to have to wait and see, but I think it's something to keep an eye on.
A lot of people did not know about the upcoming Weed 3. They're excited to hear about it. Some of them may be hearing about it as we're speaking about it. What is the one thing that you're looking forward to people seeing in Weed 3 this Sunday night at 9 Eastern on CNN?
I think they're going to, first of all, they're going to understand a lot of why medical marijuana, what it does in the body, just the true learning about this substance and what happens. But I think, besides hearing from the senators who have now proposed the most audacious legislation, besides hearing from the president, you're also going to meet the people who are really have been at the forefront of this. The scientists who have been studying it, get to know them, what has motivated them, kept them going after decades of basically being told no. And I think most importantly, the patients. An investment banker named Sean Kernan, who's also a veteran, came back from Panama years ago and has suffered with post-traumatic stress for a long time. Did everything he was supposed to do. Took all the medications, the antidepressants, the anti-anxiety medications, the sleep medications, all the things that were prescribed to him by his doctors. And what happened is that he almost died from this. He eventually tried to commit suicide. He was that bad off. And he nearly died trying to get better. And then he turns to cannabis, never wanted to try it before, wasn't never on his radar, and suddenly you'll see him. I mean, I can tell you, as you might guess, that he is a completely changed man. Wife, 4 kids. I mean, this is a successful, highly motivated guy who just wanted to get better. Amelia Taylor, who's a 34-year-old woman, a stay-at-home mom, she's got kids, also suffered from post-traumatic stress, not as a veteran, but from something else, and she was a hermit. I mean, she couldn't function as a mother, as a wife. She couldn't do anything. Church going, homeschooled gal who never thought about marijuana, and now she's tried it for the first time in October of 2014, and you're going to see the impact it's made on her life. You're going to meet people who have had pain, chronic pain that's been untreatable with narcotics, with everything. It's a life of chronic pain, and there's so many people like that out there, Steve. And here you're going to see what impact cannabis had on this person and how she's been able to use it now in a hospital. It's going to give you a real look at what's happening with this marijuana revolution at this time in our history, and I think it's going to be really important for people to understand this.
Fascinating, amazing stuff. Thank you for putting your credible stamp and your critical eye on this subject, because it's so important to so many people. And I have to tell you, as an anecdote, I'm wearing my maize and blue cap as we're doing this interview. Our studio's about 20 minutes from your alma mater there in Ann Arbor at University of Michigan. So
I feel like home. Go blue. And, I guess they're calling it Ann Arbor, I hear now up there.
They are indeed. Dr. Sanjay Gupta, thank you so much for taking the time to come on the program today. And good luck with this Weed 3. It really is gangbusters.
Thank you very much. I appreciate the time. Thank you.
Bye-bye.
Bye-bye.
You're getting the full melt.
It started with Weed 1.
Some have called it a watershed moment.
Then came Weed 2.